My guest is a public health strategist whose purple philosophy, bold and creative, steady and calm, guides how she shows up for equity. In this episode, she talks about the courage it took to leave a dream role at the National Institutes of Health and step into corporate citizenship at Altria, where she leads strategy for underage prevention and cessation support. We get into owning your choices, baking equity into the batter instead of icing it up on top, moving home to North Carolina, surviving a ground-up home build, and a new vision, trauma-informed, accessible interior design rooted in public health. You're listening to the Courageous Public Health Podcast, episode 30. To all the courageous Black, Indigenous, and women of color leading in public health, this podcast is your space to turn up the volume on your courage. This space centers your voice. This space celebrates your passion. This space amplifies your courage. My role? To listen, to amplify, and to stand with you in the fight for equity. My name is Dr. Christy McClamrock. I'm an epidemiologist, consultant, the founder and CEO of Courageous Public Health, and the host of the Courageous Public Health Podcast. Each week, I have unfiltered conversations with BIPOC women in public health about the challenges you face, the power you hold, and your vision for the future. We talk about the authenticity, vulnerability, and courage that you bring, not just to public health, but to every part of your lives. Because courage is about action, even in fear. It's about taking up space, leading unapologetically, refusing to be erased, and knowing you never have to do it alone. If you're ready to turn up the volume on your courage, if you're ready to take up space, if you're ready to smash the racist, patriarchal, cisnormative, heteronormative, ableist, capitalistic systems, then let's dive into this brand new episode. Thank you for joining me on this episode. I'd like to start by introducing myself if you're brand new to the podcast, or reintroducing myself if you're a returning listener. My name is Dr. Christy McClamrock, and I am the CEO of the Courageous Public Health Consulting Firm, where we support public health organizations through workshop design and facilitation and speaking engagements. I am so excited to introduce you to my guest on this episode. Let me formally introduce her, and then we'll jump right into our conversation. Dr. Natasha Knight is a public health leader and proud purple enthusiast. For her, purple is more than a favorite color. It represents courage, creativity, and balance. It blends the calm of blue with the boldness of red, and that's how she has approached her 15-plus year career, grounding herself in evidence and empathy while pushing boldly for equity and change. Dr. Knight currently serves as Manager of Underage Prevention and Cessation Support at Altria Client Services, where she leads equity-informed strategies to prevent underage tobacco use and support people on their quit journeys. Trained as a behavioral scientist with a PhD, MPH, and MBA, her path has also included roles at the National Cancer Institute and UNC Greensboro, where she focused on health disparities, community engagement, and mentoring the next generation of public health leaders. At her core, she is passionate about using data, strategy, and empathy to create solutions that make health more equitable and accessible. And in her spare time, she is a budding interior stylist, exploring how to bring well-being and equity into the spaces where people live and work. For Dr. Knight, courage in public health and in design means standing firm in spaces where equity isn't always the default and helping communities not just survive, but thrive. Ready to be inspired? Let's listen to my conversation with Dr. Knight right now. Hi there, Natasha. Welcome to the Courageous Public Health Podcast.
Hi, how are you?
I'm really good. Thank you. It's Monday morning for me, but I'm excited. Get my Monday started.
It's a great way to start a Monday.
It's a great way to start a Monday with a podcast interview. Yes, fantastic. So I'm really excited to interview you today. And I want to start by giving you a chance to introduce yourself.
Well, thank you. Thank you so much for having me. I'm so excited to be here. This is my first podcast interview, so
Oh, I'm so
exciting.
honored.
Yeah, thank you for
Thank
having
you.
me. It's very humbling, and I appreciate the invitation. So, I guess I'd like to start out by saying that I'm a purple enthusiast. You find it all over my closet, you find it all over my house. And I love purple, not just because of how it looks, but because it reminds me of my values and things that I appreciate in life and how I want to show up when you think about things like creativity and being bold, but also being calm at the same time. I tend to be someone who's typically very even keeled, but will stand up for what's right. And that balance of things just sort of reflects how I approach life and my career in public health. And I've spent like 15 years, more than 15 years, probably, if I start counting from like my undergrad years,
Yeah.
really working at the intersection of health equity and social impact and increasingly strategy. And that path has taken me from academia for many years. I was like, if I count, I used to tell people I count preschool. So if I count preschool to PhD, I was in school from like the beginning of time, it feels like, but for like
Oh, I hear
20
you.
something years to the PhD plus my postdoc and working in academia as a faculty member. And that took me to working with federal health programs and now in corporate citizenship and always having the same goal, which is to help make the world a better place and make health more accessible and equitable and showing up the best way that I know how as a Black woman in this space, which is often very challenging, but also very rewarding. So that's me in a nutshell.
I love that. I love that. Okay, so I have to say that I also did preschool through PhD. I did not do a postdoc, but then I went straight into a faculty position. So
Hmm.
yes, it was
It is
academia
a
for
journey, right? It's like
its journey.
school becomes part of who you are in a way.
Yeah.
Yeah.
Yes. Yes. Um, and purple. So I don't see purple on you, but where I see purple is like the reflection in your glasses is purple.
Well, they're clear actually.
But
And
the reflection is
the reflection because my laptop
because your
screen
laptop is
is all
purple.
purple. So that's where it comes in. Yeah,
That's
I'm
why
not,
that's happening. Oh, it's perfect.
mhm.
So you've
Yeah,
got the
that's not
purple.
wearing it today. But all
That's
of
so
my
funny.
accessories, my water bottle, it's
Oh, yeah.
purple. Like my pens, many of my things around me are
Beautiful.
purple. So
Beautiful. So actually, uh, this seeing purple as your like guiding philosophy, that's what you
mhm.
say on your LinkedIn
Yeah.
description. And that caught my attention when I found your profile on LinkedIn.
Mhm.
And the other thing that caught my attention was a post that you put out. It was a tribute to your mom who had
Yeah.
just retired from
Mhm.
being a teacher for many years. And it was this really beautiful, moving tribute to her. And I thought, I love that. I was telling you, before we hit
Yeah.
record, that I feel like, you know, there are often lots of people in our lives who deserve celebration and
Yeah.
deserve some like, vocal vocal love, right? Show
Yeah.
of love.
Yeah.
And a lot of times we have the thought and then we don't actually do it because time and life and all of those things. And so the fact that you put it on LinkedIn and it showed up on my feed, was just, I was just really moved by that. And my mom was a elementary school librarian. And so,
Yes, I remember you mentioned that when you reached out, and I imagine that she has very similar experiences to my mom, who worked um,
yes,
as a kindergarten aide for many years. But yeah, I believe that we should, and the older I get, the more important this is. But I think it's important for us to give folks their flowers while they're here with us. And
absolutely.
there are many ways that we can do that. Sometimes it's a simple thank you. Other times
Yeah.
it's a LinkedIn post. paying tribute to a 30-year career. Like, I still don't know
Amazing.
how she did it. It's amazing. And there are many people who have that story, their own rendition of that story, and all of our teachers deserve many flowers, especially today. So I was happy to have the opportunity and happy that she is still here to see it and to receive that praise.
Absolutely.
Yeah.
Yeah. And you said something about, people would come up and they'd be, Mrs. Brown, right?
Everywhere we go,
Right.
everywhere. We were at open house for my youngest sister, who is today starting her senior year of high school. It's so
Wow.
exciting.
Oh,
Yes.
shout out to her.
Shout out to her. She's an amazing young woman. And we went to open house on Thursday, and my mom, as we're walking into the door, she's like, I'm not going to see anybody I know, I'm sure. We're going to get in and get out. And before she could take two more steps, she sees a family. They're like, hey, Miss Brown. I'm like,
Oh,
here we go.
that's
So it's like every time we could only walk like 3 or 4 feet before she would see someone else that she knew. And
yeah.
it took us like 2 hours to walk the halls because she
so
knows
funny.
everyone. And now that my
Right.
sister is a senior, she knows everyone. And she
Right.
knows all of her teachers. And
Right.
yeah, so
Yeah.
it's fun to watch. And I
Yeah.
just learned to just be patient and
Right.
wait for her to make her rounds to see everyone who it's amazing, either the people who were in her class and are now in high school or adults with their own children, or the people who have had kids in their class, or the grandparents who have had grandkids in their class. It really is. It's a beautiful thing to see.
It's a beautiful thing.
And we pick on her about it, but it definitely is. It's an honor to see so many people recognize her and actually want to speak, because we can all have teachers that we
Right.
want to run from when we see them in public. So so
Oh, that's great. Yeah, my mom's version of that was, hey, Mrs. Mac, right? Like she didn't ask any of the kids to try and pronounce the Clamrock. It was elementary school. It was, hey, Mrs. Mac. So
yeah, it's so cute though. I love that.
it's so cute. It's so cute. Well, great. I'm glad that I saw the post, and I'm glad
Me too.
that I connected with you and that you are here.
Likewise.
Okay, so let's jump into our questions. So the first question is about courage. And I always like to remind our listeners that bravery is about taking action without fear, whereas courage is taking action despite fear. And I would love to hear from you about some of your experiences in your professional life, in your personal life, where you've acted courageously.
Yeah, and we've chatted about this a little bit, but I would say the biggest moment of courage in my career so far has been my decision to leave what I thought was a dream position at the National Institutes of Health to accept a position or an offer for a position at Altria. And for the folks who don't know, Altria is a tobacco company. So the brands that are commonplace, like Marlboro, Black and Mild, Copenhagen, we are the parent company of those operating companies. And I was really burnt out from doing public health as usual and wanted something different, and saw it as an opportunity to grow, to think about public health differently, and to stretch myself in a way that I never would have thought, especially coming out of a place like Johns Hopkins School of Public Health, where they were not happy with me, for making that decision. There were many people who were not happy with me, but I knew what I needed to do for myself, for my career, to maintain my sanity and my health. And it also allowed me to be closer to my family. So driving from DC to North Carolina was getting increasingly cumbersome. And like a serious challenge when it would take 6 or 7 hours as opposed to the 4 that it used to take. And I said, well, I need to, one, be more financially stable. I need to be happy in my career. I need to be closer to family. This position is one that I can take, and as long as the work that I'm doing doesn't violate my values, I can at least try it out. And so I told myself, I'll give it 3 to 5 years. And here I am on year 7. Okay. And I'm still here.
Yeah.
Doing a little bit of a different type of work than when I walked in the door. When I walked in, I was working on a team that focused on conducting research to support regulatory applications and to support and inform our broader strategies on underage prevention and cessation support. And now I work on the team that actually leads the strategy for underage prevention and cessation support. So in a very strange way, I do public health more, I guess, intensely in my current role in some capacity than I have in other roles. So it's still a move of courage every day that I show up, because it's still tobacco, and I'm still a public health professional working in this space.
Yeah. But I mean, how important to have public health professionals working in that space.
That's what I say. I was like, don't you want somebody like me on the inside?
Absolutely.
Providing expertise for the strategy and, helping people quit when they decide. That's what I do is I focus on helping the company develop strategies to meet people where they are when they decide that they're ready to quit. Like, why wouldn't you want someone with a PhD from Johns Hopkins in that role at a tobacco company so that we can be more aligned with what public health says is the right way and the evidence-based way to do it?
I think that's really powerful. And, especially when you think about where things used to be with tobacco companies. Mm-hmm. I mean, I feel like that would have been unheard of. Absolutely. So that feels like a lot of progress for tobacco companies to actually be in this place. Absolutely. Where that's something that they, value.
And my decision to join Altria was in part because I know I learned from my research and can see even more than the longer that I'm there, is that it's a company of integrity. They really value compliance and doing things not because it's a PR move, but because it's the right thing to do. So when we talk about underage prevention and we talk about cessation support, we're doing those things because we recognize our corporate responsibility to do so, not because we need a fancy byline or to convince shareholders or other stakeholders to trust us. And many people don't trust us, and rightfully so, given the history of the industry. Sure. And I don't ever question anyone or try to convince them otherwise. Yeah. Unless they are saying things that are factually wrong, right? That's different. But I'm not going to try to change anyone's opinion of the industry. I just do my role to help us show up in the best light possible.
That's great. And I can see how that takes a lot of courage.
It absolutely does. Yeah, it does. And it's taken me a little bit of time to find my voice. So a couple months ago, when I celebrated my 7th year, I made a LinkedIn post about just that. It's like, it took me a minute to get to the point where I would tag Johns Hopkins in a post like that said, hey, I came from this background and I'm here and I'm owning it. And it's not always easy, but it's my truth, and there's great impact to be made, not just by me, but by what we do as a company in general. And that's important for folks to understand.
And it's so important for us, for everyone, to feel like they can own their choices.
Absolutely. Absolutely.
I don't think there are any choices that there are always people who have differing opinions, which is fine. And like that, to me, that is part of taking up space, is being like, I'm going to own my choices.
Yep, absolutely. So
I know it was also an act of courage for you to make the move. You made a move recently, right?
Yes, we did. Actually, we've made multiple moves. Oh, yeah. So last February, actually, we decided in, I think, December of 2023 that we were going to, my husband and I decided that we were going to move to North Carolina. And this was not planned. I am a planner, and in my head, we were going to be in Virginia for like another 5 to 7 years. And we decided, because of a number of things, that that was the right time. And we moved in February of last year, put our house on the market in Virginia, and it sold in like, I don't know, we put the house on the market on like February 19th or something, and we closed on like exactly 60 days later. So it was relatively quick for the market, and we did not have a house to move into in North Carolina. So we moved in with my mom, thinking that it was going to be a at most 6 or 7 month stay while we were shopping around for a house. And then we decided that it made more sense to buy some land and build a house. And oh my gosh, my mom and my husband generally get along, but in many ways they are so alike that they anyway, I won't go into detail, but sometimes they're so alike that it makes life interesting.
Yeah.
So there was a lot of courage there, because, it's not that I didn't think that we could all do it, right? It's like 3 adults and a teenager who's almost an adult living in a house. And we had our own space, right? We're, of course, sharing the kitchen and common areas. But
yeah,
man, I did not know what to expect. And those were some roller coaster emotions. But we got through it. It took way longer than what we expected. Let's see, we moved in February, found our land in March, actually closed on the land and the construction contract in June. And they didn't start until September, October, when they were supposed to start in July. And so we're just moving into our house in full last weekend, and here we are in August. So
yeah, that's a long stretch.
A long stretch, way longer than what we planned or anticipated. Like, it just, anytime a builder tells you it's going to take them any given amount of time, double it, and then you'll set your expectations at the right level.
Yeah.
Yeah.
Yeah. Yeah. Those are big. I mean, there are multiple big decisions in what you just talked about. Like,
absolutely.
That, again, take courage and,
building a house took just as much courage as moving here. Like, you don't have any control over that unless you happen to know a lot about construction and contracting business. Like, you kind of just got to trust that they're doing what they're supposed to do, and that they know what they're doing, and that you're going to move into a house that's not going to fall apart in 6 months.
Yes.
So I really learned a lot about just like trusting the process, not necessarily trusting a specific person, but trusting the process, and relinquishing control of things that I really could not control. And also speaking up when you see something is not right. And I'm very non-confrontational. So that to me was not always comfortable, but it's like, well, with all this money you're paying, you can not confront and then be very dissatisfied later, or you can go ahead and say what needs to be said and ensure that you get the house that you have been waiting for and dreaming of all these months. So,
yeah. Well, that actually leads us beautifully into my next question, which is about courage as claiming and expressing your power, especially in spaces that may not always welcome it. I wasn't, when I wrote that question, I wasn't thinking about, things like the contractor may not welcome, may not always welcome it, but it actually, that is true. And then it does take courage to stand up and say, hey, this isn't right. This needs to adjusted.
Absolutely. Yeah. And I think in the health equity space, that's what we're doing
Yeah.
all the time,
Yeah.
right? We are saying, hey, this is not right. We need to make some adjustments to make sure that everyone has access to what they deserve, which is healthcare and
Yeah.
health and quality of life and all the things that go into that, the basic social needs, like there are things that we shouldn't have to speak up for these things. They should be just common sense, just human courtesy, just like we talked about humanizing, like things that are just humanizing. It should just be the human thing to do to make sure that everyone around you has what they need to be well. And that's
Yeah.
not what we see in our society today or ever, really. And
Yeah.
health equity, like I said, is all about speaking up for those people and saying this is not where we need to be. And it used to be that we would say health disparities, and before that it was minority health. However you say it,
Yeah.
it is about speaking up for people and being confrontational in the face of systems that equity is an afterthought or not a thought at all. And when you approach equity that way, it's like, well, we have to build it first, and then we can think about how to make things equitable. It's so backwards. There's no way that equity can truly be baked in that way if you're putting it as the icing as opposed to mixing it in with the eggs and the sugar and the flour. It's got to be baked in there, not just as something that we put on top to cover all the flaws of whatever the system happens to have that's not perfect.
That's a great analogy. I really like that.
Oh, thank you. I've never used it before, but
It
it worked.
It totally worked.
It worked.
It was totally inspired. Look at that. You
What?
just came up with that right now. Love it. I love it. I love it. Okay. Well, I also, of course, want to hear about your vision for the future. And I'm thinking about your vision for public health,
Yeah.
your vision for health equity, how you see Black women shaping these futures. And then, of course, I always like to end on your personal vision for the future. Yes.
Oh,
Now that you've made this huge move,
I know.
finally in your house.
I know. I have time to think about all those things again.
Yes, you do. Yeah, you
and
do.
the mental capacity and bandwidth.
Yeah.
I guess my vision for public health really is what I said before. It's a place where we all have access to what we need to be well. So that doesn't just mean like healthcare. It also means things like transportation, education, being able to, earn a living wage that that actually pays your bills and leaves you with some left over to maybe take a weekend vacation to recharge your battery. Just like, again, basic human needs.
Yeah.
We all need rest. We all need to feel safe. We need each other. So it's I think when you ask what is the vision for like Black women in this space, is that we don't have to do it all alone, because I think so often, especially as you think about what's happening in our society politically, we have many Black women feel like we have really carried the burden, the torch, waved the banner, however you want to say it, ourselves, and that many folks have not come alongside us with the intensity or the consistency or the understanding even that they could and that they should. So I would love for it to be a space where Black women are not always at the helm by them, or feeling like we're always at the helm by ourselves trying to confront this society. And I know that there are other groups who are fighting for justice in the health space and other spaces as well. But I think when you see t-shirts that say protect Black women, there's a reason why.
Yes.
You see those shirts and those banners and those types of posts on social media.
Yeah.
So I would love for us to be able to show up with alongside others, protected, not afraid to do so, and being effective, more effective because we're united with other people. I'm a Christian, and I was just listening to my pastor say, within the past week, he was talking about their strength in numbers. And he's like, that is correct, but that's incomplete. So there's strength in numbers when we are united. So if we could get to the point where we have the numbers and the unity where we are all working towards the same goal of, I don't think it's utopian. I think, it's like this should be standard,
Oh
right?
my
When we are
gosh.
all working towards that goal together.
Baseline, please.
Exactly. It's like, yes, baseline. Like this is like just the lowest bar, right? That we should have for ourselves as a country, as a global society. So that's my vision for the field and for our society in general. Yeah.
Yeah. No, I like that. I think your pastor is right that phrase, which, we've all heard a million times, is incomplete. What a great way to, sort of adjust that way of thinking. It's like,
yeah, it really, I mean, I think he's spot on.
I think he is too.
All of us can be together, like, moving in, we could have a horde of people, but if we all disperse and we're all going in different directions and we're not, united, and we can get to it in many different ways, but we have to have a united effort to do it.
Absolutely. Absolutely. We need a united vision, a united. Yeah.
Yeah, absolutely.
Beautiful. So what about for you?
Oh, for me, my vision.
Yeah. What's next for you?
My goodness. First is making sure that the house that we've just moved into begins to look like a house and not a storage facility. That's the main thing.
So that's so exciting, though.
It's exciting. I'm very excited about it. We've, already done some things to make it more our own. Yeah. And, it's a blessing. Like I am more amazed by the fact that I was able to come home to my little county in North Carolina and build a house than I am that I got a PhD. Like, land ownership and building a house, that's big. Like, it's just, it is amazing. And I don't take it for granted. Like, my grandmother started off with like less than an acre with this tiny little like single wide trailer years ago when my mom was in high school, and my husband and I bought way more land than that and built a much larger house than that, and it's just not anything to take lightly. And it's likely on land that was owned by a plantation. So there's just a lot of different, there's just so much emotion. Yeah. Right. Yeah. There's just so much emotion wrapped up in that, and so much gratitude, for what we have been able to accomplish with the help of our family and those who love and support us. But my vision is really to, one, make this house our home. I love interior decorating and interior styling. And when we sold our house, I staged it, and we got compliments like, who staged their house? And I was like, hi. Thanks. Appreciate that. I did it myself.
Amazing.
So our realtor was like, you really should look into this and see if it's something that you want to do. More regularly. So I've taken a couple of classes, and I'm really hoping that I can incorporate those same equity principles into interior design and start some sort of practice that makes interior design more accessible to people who need it and is more focused on trauma-informed approaches, so that we're creating spaces that, again, help us be our best selves and help us be well wherever we are, whether we're at home, in our offices, talking about schools, or getting your nails done, or whatever. I I think that interior decorating is so expensive. It's ridiculously inaccessible. And I want to make it so that whether you have a $150,000 house or a $1.5 million house, you can access the services that you need to help you make your space work for you, as opposed to you working for your space. So that's my vision for the next 3 to 5 years.
Yeah.
Yeah.
That's incredible. I mean, and just to put those things together, like equity, trauma informed, interior design, and with your public health lens. I mean, if that's your hobby, that's a really, really amazing hobby.
It is sort of a hobby these days, but hopefully it will become more than a hobby. But we just deal with so much. I think that undercurrent of stress from the constant bombardment of this, I don't even know I don't know if I call it trauma, but experiencing the news sometimes is traumatic, right? So how do you counter that in your everyday? Not everyone can go see a therapist every day or wants to, or has access to that sort of thing. So what can we do in our own spaces to make it more therapeutic for us, to help us manage what we're dealing with every day?
Yeah. And your home is that's your space.
Exactly. Yeah. So it should be a place that works for you. I wholeheartedly believe that.
Beautiful. Well, I really appreciate you coming on to the podcast. And now you've done your first podcast interview.
Thank you.
Your first of many.
I hope so. This was
just
really
the beginning.
Fun.
Yeah.
Yes. This was excellent. I appreciate you and the invitation and making this such an easy process. It does not feel like a podcast interview at all. So
I want it to just feel like a conversation. Yeah.
That's exactly what it's been. I appreciate it.
Well, now this part is going to feel like a podcast. So how can our listeners best connect with you?
Yeah, the best way, if they wanted to get in touch with me, the best way is to find me on LinkedIn.
Okay.
Yep.
Great.
Natasha Knight, and I'm there.
Great. So, and I always want to invite the listeners to learn more about you and your courage. So that's great. And we will put that in the show notes, on the show notes page, which is on the website. And then people can connect.
Absolutely. I'm looking forward to it. I welcome the connections. I love to learn. I love to hear what other folks are up to. So,
absolutely.
Yeah. And please, if they reach out, please do let me know that you heard about me on this podcast, because that's going to be
cool. Yes. Okay, great. Well, thank you so much again. This has been really, really great, really wonderful.
Absolutely. And, thank you, Christy.
Yeah, we'll be in touch.
Absolutely. Thank you.
Sometimes courage is owning a hard pivot, choosing the path that fits your values, even when others question it. Sometimes courage is refusing to ice equity on top, insisting it be mixed into the batter from the start. Sometimes courage is turning a house into a healing space where rest and safety are part of the design. Dr. Natasha Knight reminds us that purpose can be both bold and calm, and that our choices at work, at home, and in community are where equity truly takes shape. You can connect with Dr. Knight on LinkedIn to learn more about her work and her courage. All the links are in the show notes page for episode 30 on our website, courageouspublichealth.com. Before you return to your day, take a minute to sign up for the weekly Courageous Public Health podcast email updates so you never miss an episode. You can do that on our website too at courageouspublichealth.com, because there is more great stuff to come. Thanks so much for being here. And until our next episode, stay courageous. Thank you for listening to the Courageous Public Health podcast. Visit courageouspublichealth.com to find the show notes for each episode and learn how to connect with us.